Hello, I'm Dr. Nandini, Senior Consultant Gynecologist at Akkineni Hospital. Wishing you well. In this session, I'll highlight some important points. Please stay tuned and take notes.
If you've ever heard the words high-risk pregnancy, you know how much your heart can sink in that moment. It's a heavy label. So today, we're going to unpack it. We're going to figure out what it really means and hopefully trade some of that fear for a feeling of empowerment and calm. So let's dive in. And for this, we're leaning on the incredible, compassionate expertise of Dr. Nandini Bhuvanam. She's a specialist who is right there in the trenches, working with expecting mothers every single day. You know, her very first piece of advice is so simple, but maybe the most important. It's just, please take a breath. Just let that sink in for a second.
Okay, first things first. Let's talk about that scary label head on, because the words themselves just carry so much weight, and it's time we lighten that load a little bit.
This is so crucial to understand right away. That label, it's not a crystal ball. It is not a prediction of what's going to happen. And it's definitely not a warning sign. So if it's not those things, what is it? Let's get right to the heart of what high risk actually means in the medical world. It's time to swap out that fear for some actual facts.
So here's the real definition. It's just a medical term. Think of it like a flag for your doctors that simply says, hey, this mother or her baby might need some extra monitoring, a little extra care. Why? So that everyone has the best possible outcome. It's all about proactive support.
Exactly. It's professional shorthand. It's just the language doctors use with each other to make sure you're getting the right level of attention from day one. It is medical language, not a life sentence.
All right, so now that we know what the term actually means, let's talk about just how common this is. Because honestly, knowing you're not alone in this, that can make a world of difference.
Just take a look at this number, 20%. That's 20% of all pregnancies. 1 in every 5. Let that sink in. If you get this label, you're joining a massive community. So many parents have been right where you are. You are so far from being alone. So what kind of things lead to this label? Well, a lot of the time, they're really common and totally manageable things. You know, like carrying twins, being over 35, or having something you already manage, like diabetes or high blood pressure. These aren't catastrophes. They're just data points for your team.
And that brings us to what is actually the best part of this whole story. Getting the label isn't about the problem. It's about getting the solution. It's about mobilizing your extra care team.
And here's some really good news. Modern medicine is incredible. The way specialists can monitor you, catch potential issues super early, and manage them, we've never been better at it than we are right now. I just love this analogy from Dr. Bhuvanam. She says the extra care isn't something to be scared of. It's like a caring mother, an amma, just keeping one extra loving eye on you. See? It's an act of care, not a state of alarm.
Okay, so you've got this amazing support system ready to go. So what about you? What's your role? Let's talk about the simple but really powerful things you can do to be a partner in your own care.
It really boils down to these 3 things. 1, get to your appointments and get there early. Don't delay. 2, be an open book. Share everything, your fears, your symptoms, even the tiny things you think don't matter. And 3, trust your team. These people are the experts, and they absolutely have your back.
Oh man, we've all been there, right? That late-night doom scrolling on Dr. Google or getting conflicting advice from relatives who mean well. But when it comes to your health and your peace of mind, the best, calmest, most accurate source of information is always your medical team.
Okay, let's bring this all home with a really powerful way to reframe this entire experience. We need to see this as more support, not less joy.
Because no matter what label is on your chart, this is still your pregnancy. This is your journey. You deserve to feel the wonder, the excitement, and all the happiness that comes with it. Don't ever let a medical term steal that joy from you. And this right here is the single most important thing to take away from all this. This is the core message. High risk does not mean less joy. It just means more support. So we'll leave you with this final thought to chew on. What if we just completely flipped our perspective? What if, in the world of pregnancy, the word risk is just another word for support?